supposedly sterile in there. It's really basically clean, but we just call it sterile. I'm going to grab the inside of the glove, which we just did, put my hand in. I'll leave this so you guys can use your little large gloves. These aren't sterile. I couldn't grab it back from the box. But if they were in that kit there, let's say they were in here. You got to grab the inside of the glove. It's folded over, so I grab the inside. I just stick a hand in, and I use the inside of the glove to put it on. I don't touch the, I guess the outside of the glove. Then the other one, I could touch the whole glove because this hand's sterile. And one thing you want to try to look for your thumbs, so when you slide it in, your thumb's on the right side. And now both hands are sterile. The gloves will be out of the way. So I'm going to grab this, just a basin. I'm going to put. They're still sterile because that was inside here. But now, let's say I want to suction with this hand, I'm going to grab the water bottle with the other hand. I would unscrew it beforehand just so it's easier to pop off. Put a little saline or sterile water in there. And then I would grab my suction catheter with my sterile hand. This stand has to stay sterile. So I'd hook it up. I'd grab the suction with the other one, hook it up. I could hold this with the other one, but this one would be the hand that I'd have to use to put the suction catheter down. And I would only touch this part of the suction catheter. Here's our suction catheter over there. So I would just... it's not required to wrap it up, but you just control it better this way. So I put that on. I can use this non-sterile hand up here. I usually like to hold this with one hand. Go down, I would have hyperinflated, hyperoxygenated. Then on the way out, I'm going to intermittently suction. And you got like 15 seconds. Wrap it back up, put my bag back on, hyperinflate, hyperoxygenate. Check my sat monitor, and then do it again.
So
the part people will mess up is the sterile technique. Like if I'm suctioning here and I'm in between, I can't touch them all. That would be disgusting to touch yourself with it because you have mucus all over it. But I can't grab this. I can't touch anything else. This hand, only the suction catheter. Okay. Any other questions? No?
So it's okay for you to use your non-sterile hands to press this one?
Yep. Yeah. You pretty much have to.
Okay.
Yeah. So it's probably technically not sterile, but you just want to be as clean or sterile as possible.
How many times do we go in suction?
Probably like 2 to 4 would be an average. Like if I went down the first time and got nothing, I might put a little saline, bag them a little bit, or second time nothing, that would be it. Like if I got a lot the first time, second time, third time, usually around, see what the patient can tolerate, but the norm would be 2 to 4 times. Not that you couldn't go, and even if you get to 4 or 5, you might want to give the patient a break, even if you think they still, it depends how, it's more just enough to clear the secretions. And once in a while, I like to just, probably at least each shift when you do a vent check, this is not, you're going to have an inline suction for the most part, but just pass it down and make sure that the airway's patent, it's clear. And of course, real important here is, even if the patient's out of it, tell them it's going to be uncomfortable, make them cough, that kind of stuff.
What's the saline in the cuff? I mean, what would you do with that?
Just going to clear out my suction catheter.
Okay, in between suction.
Yeah.
Okay.
Again, when I'm getting everything set up, I would grab my bottle and I'd take the lid. You can leave the lid on but loosen it, because to do that with one hand, you can do it, but it's tough. Then I just pop it off, pour some in, and then in between suctioning, I'm just going to clear out my suction catheter.
Okay.
And if it's one person, you might need that other hand of bags. You might not get a chance to clear it between, but that would be the idea.
Okay.
In this, when I'm putting this in here, I wouldn't want to, if I touch it, now it's no longer sterile, so you wouldn't want to use it. Until the end. You could use it at the end to clear your suction catheter.
Okay.
Even this line gets disgusting and occluded, so you want to just clear the whole thing. Same thing with an inline suction. You put a little bullet on there and clear out your suction catheter in between. So put a saline on here and just make sure this is clear. Of course, make sure the black's outside here. Never want it stuck inside.
And this is just normal saline that you're using?
Yeah, he would use a normal saline for these. They're little pink things running around. They look just like the little unit doses we use for medications, and they just fit right on there. The package for this will come with about, I don't know, maybe 10 of them, and they're a little bigger, to at least 10 cc's, maybe. They're at least 10 cc's down, they're pretty big. But you don't, with saline down the endotracheal tube, some people think you should use it all the time. You probably shouldn't. I would just try to do it without it, and if you're getting stuff without it, don't put it down, but still use it to clear your suction catheter. Different people, some people think you should all the time, some people think you shouldn't. But you probably shouldn't just be squirting the crap down there. But when you're squirting it, this should be normal saline. This doesn't really matter if it's normal saline or sterile water because I'm only clearing out my suction catheter. Oh, and when you do a aerosol mask, they'll probably have sterile water and saline, so you see if you pick the right one. What would you use for an aerosol mask? Yeah, sterile water. Yeah. So they'll probably have both bottles sitting there, and you decide, which one you're going to use.
Do you do nasal suction?
Yeah, you'll do NT too. It's the same thing. Sterile technique's going to be the big thing. Hyperoxygenate, hyperinflate. Know what a nasal trumpet is. Yeah, that's about it. And with NT suction, you'd want to lubricate the endotracheal tube. So you have a little pack of lubricant. You probably won't use it, but just mention that you would lubricate it to put it down. You don't need to do that for the regular endotracheal tube, though.
Question. So, you said we have to put saline in here to clear it out.
Clear it out, yeah.
Yeah, but what do you mean? Is it going to go into?
Nope, I'm going to find a little bullet of saline. Where's the syringe? We could just put that on. Say I had saline in this syringe here. I would just put it right here, connect it, and I'm going to hold the suction down and just squeeze a little saline in. And the saline's not going to go to the patient; it's just going to go right through here and into our collection chamber over there. So hold it down the whole time when you're squeezing it in to clear out the suction tube. And this is what most people use nowadays. And you'd go in with a regular pair, like generally when you suction, you're going to walk in, you're going to wash your hands, you're going to put a regular pair of gloves on. It's probably better to put your sterile gloves just over top of your regular gloves. Bless you. Because you're always going to have, gloves on in the rain. Good? All right. Put this on here, and then bag them, hyperinflate, hyperoxygenate. Take it off, suction them, and then, again, you're using one hand, so sort of try to set your bag up so you can do it. And just set it up. Now, with this guy, is there a mask for this now? There's one over there. Now, if I'm NT suctioning them and I have a sterile hand, you can't, because remember, you got to create a seal. Some people will say you could hold this over them and let them breathe on, but I don't think that's the greatest idea. I would put a non-rib breather on them and pull the non-rib breather down to say just over their mouth and then NT suction them. That's what I would do. I would have this close by in case I needed it, hooked up and ready to go, but there isn't, like they say, the patient can suck in if he takes a breath, he'll open up that ductbill. But it's easier just to put a non-rib. I think it's safer and easier to put a non-rib breather on.
For the competency, though, we would have to do the
I think that's going to depend who you do it with.
Okay.
I don't think you should be doing this with one person, just holding the mask over there. One person would suction and the other guy coming back, then you go in and suction. With an endotracheal tube, you can do it, but not with, I don't think you can do it with, and some people may say you can, but I don't like that idea.
With the The sterile one, you just
Are
hit
we
the
hooking that up for the
100%
competency?
on the ventilator.
Oh yeah, yeah. If you have the inline suction, just hit 100% on the ventilator.
Mhm.
And there's also a button on the ventilator you can give extra breaths
And
with.
put it on what? Whatever fills up the bag.
Yeah,
So we'll put it on
like a flow meter, like
and put on 100%.
a. You wouldn't be able to put it on 100%. You would just do it to fill the bag, so that when you squeeze it, it would give out 100%. You know what I mean?
Can you put your videos online
Yeah, I've
somewhere?
already put 3 of them on YouTube.
Awesome. Really?
Yeah, you just type in WCU Respiratory and they come up.